Hi everyone, welcome back to my channel. It's that time when I tell you all things teeth. And today I thought I would answer some of your questions because there have been so many questions coming through on Instagram. So this video is all about you. It's all your questions and answers. So let's crack on. It does not matter, honestly. I know you weren't expecting me to say that, but I just love the fact that you use anything. That said, floss, I would say, is the gold standard. And it doesn't matter whether you're using floss or tape. They're slightly different whether they've got wax in them or they're unwaxed. I've just set off a whole host of new questions I can hear. But if you're using the floss, it cleans in between your teeth and it gets right underneath the gums. You can also use the little bottle brushes or, there are different brands. One of the most popular ones is TPs and they just get in between your teeth. They don't go down as deeply as floss. So I always say you do actually need to use both, but I'd rather you use one and choose the one that's your favorite. And of course, water flossers. Do I call them water flossers or water picks? Water pick is the one that a lot of people know. It's probably the most long-standing brand, and that works by a jet stream of water going between your teeth. It can be really messy, but it's fantastic, especially if you're wearing braces. So hope that answers all the questions. Let me know if you've got any more about this particular topic. What a brilliant question, and I have so many things in my toolbox that can help this. It really depends on the number of teeth. If it's just one or two, I can just maybe use a bridge. And what a bridge is basically what it says. You have a false bit on either side, so you have teeth there that's supporting it, and then you have the false one in the middle. And it can be stuck behind your teeth, which is the most conservative. That's called an adhesive bridge, which is great, but it can come off. But if it does, we just stick it back on again. You can have a fixed bridge, which means that you basically have two crowns and then the false one in the middle. So that's kind of more permanent, but it does involve more drilling of the tooth. Implant is brilliant because with an implant, you don't affect the teeth on either side. But with an implant, we need to make sure that there's enough bone there. So that's something that your dentist or the specialist will need to assess. And finally, obviously there's dentures. Not my preferred choice, although sometimes there's no way around it because the denture can tend to move around and can build up plaque. But really, the bottom line is you don't need to have gaps. There is always something we can do. Well, they don't pay, but you're going to have to. And it really depends. It can be anything from, I'd say on average, about £4,000 right up to about £50,000. And what I normally say to people when they come to me for a smile makeover is think about buying a new car. So if you've got that in your mind, then generally you're within budget. You're not going to get a smile makeover for £1,000. That doesn't even cover the lab fee. It is an investment, but oh my gosh, what an investment. Every day you're going to get a lot of bang for your buck because you're going to be smiling, you're going to be talking. So if you're thinking about it, then just do it. But you know I'm going to say that, don't you? The most effective process for whitening your teeth is number one, see a dentist. That's the gold standard. And it's using peroxide. It's totally safe as long as it's within the remit of a dental practice. And once you've done that, don't let anybody fool you. You need to maintain it because anything that will stain a white shirt is going to stain your teeth. And how do you maintain it? You know what I'm going to say, folks. You need to invest in my smile, in my new brand. There's a whitening pen that's excellent. So that I've designed it so if you have had professional whitening, you could just literally use the pen on your teeth, and then if you use your trays, it works brilliantly because it stops the saliva getting in and diluting them. So that way, you can have it all. My advice to new dentists is just be you, be authentic. Your focus needs to be on your patients. Give them the very best that you can. Invest in your training, invest in yourself, and It's time. There's no quick fix. It's really hard graft. So just kind of keep doing you and keep giving your best, and it's going to pay off. This is such a common question because receding gums is such a problem for so many people. You may have heard the term long in the tooth, and what basically that means is that the gum moves downwards, and so you see more of the enamel of the tooth and it looks longer, and usually it's quite aging, and it just lets you know that the tooth has been around for a long time. So what can we do? I mean, the best thing is prevention. How can you prevent it? Is so boring. I know I keep banging on about great oral hygiene. It's that time, that investment in your brushing, in flossing, in using the right tools and all those lifestyle choices that we all make. That said, there are certain things that make it worse. The type of toothbrush you use, if you're brushing too hard, your technique, if you're scrubbing or doing that, which is why so many of you know I'm always going on about investing in an electric toothbrush, because it helps you learn the kind of pressure to use. If you push too hard, if you're too aggressive, the gum is, you need to be gentle with it. You need to treat it with respect. And once you've lost it, it doesn't grow back. What else? The type of bite that you have. There are so many factors, and if you start seeing it happening, don't ignore it. Do speak to your dentist, because there are things that we can do to, one, help prevent it, and also the periodontist, who's a gum specialist, can sometimes help put it back and put new gum on there. So don't despair, just seek advice. Treating worn enamel, what a great question. And for those of you that don't know, basically, actually, even I'm thinking about that, whether you mean enamel where you've lost enamel, and the term for that, actually, the posh term, is called erosion, and that tends to be with acid. So if you're drinking too much soda, you're eating too much kind of fizzy things or acidic things, that means that the enamel dissolves. Or is it a case of attrition? And what attrition means is that you're wearing the enamel down. So it's almost like friction, tooth to tooth, if you're grinding your teeth and things like that. Either way, it's the same solution. We need enamel. Enamel is the strongest substance in the human body, and everything that we use to rebuild it sticks to enamel. So we can use composite bonding, whether we're sticking at the front of the tooth or we're adding length. We can use porcelain veneers. So the bottom line is, yes, we can fix it. There are things we can do, so ask a dentist. I'm going to keep saying that, ask a dentist. Oh, that's a really difficult one, but so important. And it's one that I do get asked a lot, because how can you tell? And for me, dentistry can cost as much as a car, even a house sometimes. Well, maybe that's a bit of an exaggeration, but remodeling a house, let's put it that way. And whereas if it's a car, you can sit in the car, you can smell the leather, you know what you spent your money on. It's not the same for your teeth. It's all a lot of trust. So number one, I just want to reassure you that most dentists are not out to take your money. We spent years and years honing our craft. We love you, we care about you, we care about your smiles, and we want the best for you. And of course, like all professions, there may be people that aren't as ethical, but they are really, really rare. So in answer to your question, number one, I'd say trust your gut. You're there with this person, you can generally discern if they are listening to you, if they are taking on board your concerns. If somebody's just saying to you, no, this is what's best for you, that's a red flag from my perspective anyway. Ask other people for recommendations, but don't just, ask, even if it's your friends, please ask them what exactly they had done. I had somebody the other day that had unfortunately gone abroad, done dentistry, which was terrible, and now she's spending a fortune to fix it. I feel so sorry for her. And a friend had recommended it, but this friend had only had one crown. This lady had a whole mouth reconstruction, and they didn't know what they were doing. And so do your due diligence. So ask as many questions as you like. I don't mind when, sometimes patients will come and they want to have a second or third or fourth opinion. I'm like, please go and ask as many people as you need to feel confident with the person that's looking after you. There's enough of us there, so don't feel pressured. But overall, I would say, kind of trust your gut and just believe. Most of us are great. Most of us want your best interest, I promise. And if in doubt, come see me. The answer to that is, if you want your teeth to stay straight, then you absolutely must have a retainer. I say to everybody that a retainer is for life. So you have to wear it all the time, whether you wear it all night long, which makes sense, you're sleeping with it, so it's not affecting anything. But teeth move, so if you're not wearing your retainer, things are going to relapse. So yeah, sorry, but you have to. Personally, I don't think it matters whether you use it before or after brushing. I'm just delighted that you're using it. That's all that matters. Unfortunately, you can't whiten composite fillings. Anything that's man-made, whether it's a filling, bonding, or veneers, the color doesn't change. That said, sometimes you can get some surface stains that if you use something like my whitening pen, or if you've had your teeth professionally whitened, it can lift off the stains, but the core color doesn't change. The only way you can change it is either by your dentist trimming some of it away to reveal the color underneath, or replacing them. It really depends on the original crown. So the more tooth that's drilled away, the lower the prognosis, and that basically means that the tooth won't live as long. So we try and do as little drilling as possible to try and keep the tooth alive. But redoing a crown doesn't mean that it's not going to be as good, so I wouldn't worry about it. Most of the time, if I redo a crown, it tends to be because you've gotten decay underneath it, and the only way to get to the decay is to take the crown off. So it's just one of those things, and I'm sure it'll be fine. Once you've got your adult teeth, whether you're 18 or 88, it makes no difference with regards to how long the braces take, any side effects that you may get. And my advice to everybody is, what are you waiting for? Just do it. You'll be so happy you did. Hope that was helpful. If I've missed out any questions, or if you've got a burning question to ask me, please just put it down in the comments below. Do you want me to make this a regular thing? If so, let me know. But don't forget to subscribe, and you'll be first off the block to know what I'm talking about next time. Bye bye for now.